Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is leukopenia. So leukopenia or low white blood cell count happens when you have a lower than normal number of white blood cell. Specifically, you have fewer neutrophils than the normal condition. Now, neutrophils are white blood cells that act as your immune system's first line of defense. Without enough WBCs, you are more vulnerable to developing infection. So let us introduce first. Every day our body produces nearly about 100 billion WBCs or leukocytes. Then leukocytes help to defend our bodies against the intruders like viruses and bacteria that may cause infections. In leukopenia, you have lower than normal numbers of WBCs. Specifically, you have fewer neutrophils than normal. Now, neutrophils are white blood cells that act as your immune system's first line of defense. Without enough WBCs, including enough neutrophils, you are more vulnerable to the developing infections. A white blood cell count that's less than 4,000 per cells per microliter of blood is a low white blood cell count. Now, normal white blood cell count vary depending upon the age and the sex. For example, WBC count for male and children is 5,000 and 10,000 cells per microliter of blood. The female is 4,500 to 11,000 microliter of blood. Now, the overview. We have some questions like: is leukopenia a kind of cancer? No, it is not, but there is a connection between leukopenia and cancer. Cancer treatments may cause leukopenia. Now, does leukopenia leads to leukemia? No, but leukemia may cause leukopenia. Leukemia affects your blood cells, including white blood cells. Your bone marrow makes blood cell. In leukemia, your body makes abnormal blood cells that multiply and divide. The abnormal cells eventually outnumber healthy cells. Now, including healthy white blood cells that leaves your body with lower than normal levels of white blood cells or leukopenia. Now, who is affected by the low white blood cell count or leukopenia? Your white blood cell count frequently rise and fall. Leukopenia happens when the number of white blood cell in your blood drops and does not rise. People with certain medical condition or receiving cancer treatments often have leukopenia. Now, the causes of leukopenia. Now, people may develop leukopenia because they have certain medical condition, they take certain medication or have malnutrition and or don't get enough of certain vitamins. Medical condition included bone marrow disorder. First one is bone marrow disorder, which is multiple myeloma and aplastic anemia are example of bone marrow disorders that cause leukopenia. Then autoimmune diseases. Autoimmune diseases happen when your immune system attacks your body. Now, lupus and rheumatoid arthritis are example of autoimmune diseases. An infection like human immunodeficiency virus, which cause leukopenia. In case of AIDS, acquired immunodeficiency syndrome. So, what are the cause? If we found the cause, then people may develop leukopenia because they have certain medical condition, take certain medication, or have malnutrition and or don't get enough of certain vitamins. And medical condition include bone marrow disorder, autoimmune disease, and infections. Bone marrow disorder, multiple myeloma, and aplastic anemia are example of bone marrow disorder that cause leukopenia. Then autoimmune disease happens when your immune system attacks your own body, and lupus and rheumatoid arthritis are the example of the autoimmune disease. An infection, human immunodeficiency virus may cause leukopenia in case of acquired immunodeficiency syndrome. Next, the symptoms of leukopenia. Leukopenia does not have symptoms, but it can cause infection that have the following symptoms. So leukopenia itself does not have any symptoms, but it can cause infection that may develop some following symptoms like fever and chills, swelling and redness, mouth sores, red or white patches in your mouth, sore throat, severe cough or shortness of breath, painful urination or pee that smells bad, diarrhea, cuts or sores that drains pus, unusual vaginal discharge or itching. So, what are the symptoms? That leukopenia does not have the symptoms, but it can cause infection which may develop these symptoms, that are fever and chills, swelling and redness, mouth sores, red or white patches in your mouth, sore throat, severe cough or shortness of breath, painful urination or pee that smells bad, diarrhea, cuts or sores that drain pus, and unusual vaginal discharge or itching. All these symptoms may not be developed, but some of them may develop. Now, diagnosis. Healthcare providers diagnose leukopenia by doing complete blood count or CBCS. Now, they may do additional tests if they think you may have an infection. Those tests may include urine test. These tests may help the healthcare providers determine what's causing your infection, and chest X-ray. They may order this test if they think you have pneumonia. Now, management and treatment. Healthcare providers that treat the underlying cause. For example, if you have leukopenia because you have an infection, they may use antibiotics or antiviral drugs to fight the infection. Other treatments may include growth factors. These drugs encourage your bone marrow to make more blood cells. In this case, growth factors medication may boost white blood cell production. Delaying chemotherapy. If you are receiving chemotherapy for cancer, your health care provider may recommend delaying treatment until your WBC cell count is increased. Now, if we summarize today's topic, today we have discussed about leukopenia. Leukopenia is the decreased amount of WBC, specifically the neutrophils. Okay. Now, neutrophils WBC number may vary. It is average 4,000 cell per microliter of blood, but in case of male 5,000, children 10,000, female it may around 4,500. Overview we have already discussed. Now, cause. There are some causes. Some certain medical conditions, some medication they take, or malnutrition, or their deficiency of certain vitamins. Now, the disorders or medical condition may include bone marrow disorder, autoimmune disease, and infection. Now, symptoms. Leukopenia does not have any symptom, but it can cause some infection that have following symptoms like fever and chills, swelling and redness, mouth sores, red or white patches in your mouth, sore throat, severe cough or shortness of breath, painful urination or pee that smells bad, diarrhea, cuts or sores that drain pus, unusual vaginal discharge or itching. Diagnosis: we have CBC and urine test and chest X-ray. The management treatment: we have some treatment method like growth factor. We may give growth factor. We can delay the chemotherapy. This and antibiotics or antiviral may also be given. Now, thank you so much for watching today's entire video, and do like, share, and subscribe to my channel for supporting me and my channel. And if you have any question or any query or any doubt, please comment down in the comment section. I will try to reply them all. Thank you so much for watching.